in the help and assistance of his servant, as long as the servant is in the assistance of his brother. So removing the calamity from others, fulfilling the need, the haja of a human being are greatly encouraged and rewarded in Islam. And these actions occur when there is mercy, there is love for the creation of Allah. And the loving of the creation of Allah is actually loving Allah subhanahu wa ta'ala himself. It is through the love of Allah subhanahu wa ta'ala that we love this creation, because Allah subhanahu wa ta'ala has indicated He loves this creation. And the Prophet ﷺ gives a shout, glad tidings for this, when he says, creation, mankind are Allah dependent. The most beloved creation to Allah is the one who is good to his dependent. And then we are familiar, inshallah, with this tradition where the Prophet ﷺ said, the merciful are shown mercy by the all merciful. Ar-Rahimun yarhamhumur Rahman. Have mercy to those on earth, and the Lord of the heavens will have mercy upon you. So that is the reason why Islam places such high regard for medical professionals of all kinds, whether they are doctors, assistants, nurses, technicians, people just engaged in supporting these services, people who work in these institutions with that intention. They are focused on the health and the well-being of others. They are part of Allah subhanahu wa ta'ala's dispensation of the blessings of health, of afiyah, and which all of us are ordered to ask from Allah subhanahu wa ta'ala. It is recorded that the Messenger of Allah sallallahu alayhi wa sallam once advised his uncle Abbas radiallahu anhu. He said, "O uncle, ask Allah's forgiveness and well-being, afiyah, in this world and the hereafter." And this concept is covered in the Prophet's famous dua, which inshallah we all do, or let us make that intention to remember and do this. Allahumma inni as'aluka as-sihat wal-ifat wal-amana wa husn al-khuluq wal-rida bil-qadr. O Allah, I ask of you good health, chastity, trustworthiness, good manners, and contentment with destiny. Ameen, inshallah, for all of us. And interesting, ulama, including Imam Ibn Qayyim al-Jawziyah, they indicate that good manners and health are interrelated. When a person is healthy, he or she is good and well-mannered, tends to be smiling, kind, and patient. And when a person is sick, stressed, or depressed, the likeliness is to be rough, to be curt, impatient. So good health of the body is considered one of the treasure provisions of the world. And the Prophet ﷺ covered this in a comprehensive hadith. In the Sunnah of Tirmidhi, this is recorded, where he said, sallallahu alayhi wa sallam, whoever wakes up in the morning having health in his body, who is safe and secure in his house, and has one day's provision of food, it is as though the whole world has been granted to him. So beginning with health. In afiyah, we are told, if Allah grants us that, then it is like everything that is worthwhile in this world has been granted to us. So my dear brothers and sisters, then, whoever is engaged in the facilitating of afiyah, of siha, of well-being and health, especially for those in need, they deserve the recognition and support from us. They deserve the reward, inshallah, will be coming from Allah subhanahu wa ta'ala. And generally, while the medical professions, they are well paid, have social status, those amongst them are particularly special when they are serving humanity, serving the creation of Allah, with compassion, with mercy, without concern for making more and more money out of each transaction. Our recognition and our support is due because their primary objective, inshallah, is serving the creation of Allah, helping humanity, helping the ill and needy people regain their health, and helping to remove calamities from the creation of Allah, inshallah. And let us remember that we have a strong push very clear in this regard, but quickly I'll address a couple of them. In the Sahih of Imam Bukhari and Imam Muslim, Abu Hurairah radiallahu anhu related, so very commonly known, but let us be reminded. The Prophet ﷺ said, Allah has not created any illness except He has also created a cure for it, except for one illness. And as He said, that is old age. So, we will face adversity. We are, like all of us, will face at some point in our life illness. And we are expected to have tawakkul and faith in Allah subhanahu wa ta'ala that there is a cure for it. But we have to take action to make sure that we are seeking and obtaining it. And this was confirmed. There was a time when some villagers came to the Prophet Muhammad sallallahu alayhi wa sallam and said, "O Messenger of Allah, shall we just rely on the tawassul of Allah subhanahu wa ta'ala? Or should we use and resort to meditation for our healing?" And the Prophet ﷺ, he responded with a firm command in answering the question. He said, "Yes, O servants of Allah, seek and use meditation." So, in order to implement this command of the Prophet ﷺ, we are reminded of the need for those who are dedicated to medical knowledge, to seek out knowledge. Those who are doing ongoing research into the latest diseases, coming up with the right cure. The example of the vaccines that have come out, the messenger RNA and other technologies to tackle the COVID and its variants, all of that, they are part we should recognize for Allah subhanahu wa ta'ala's plan of diseases and the cure that He created through the people that He blessed with His knowledge. So, we need to keep that all in mind, brothers and sisters. And as I end, there is too much I wanted to talk about. I'm going to condense this in a few minutes because I wanted to remind at least our medical professionals, and I hope to do this when I address this gathering, of the wonderfully illustrious, inspiring legacy that we have of Islamic medicine throughout history. Beginning with the focus on gathering all of the available knowledge. Remember, we told Imam Shafi, knowledge of medicine is so important on par with other religious knowledge that you have to obtain it. So, the initial phase included a focus on preserving the knowledge that others had and codifying it, and the Muslims took the lead in that. And then the Apostle Khalid al-Ma'mun took a giant step in the direction of establishing translation departments to pull the medical knowledge together and then applying that to practical medical treatment. That was the basis for medical colleges, on the strength of which medical practice occurred. And that contributed largely to innovations in hospitals, hospital design, ambulatory patient care, mobile clinics, all of this part of the Islamic legacy. And just some of the greatest achievements, the Al-Nuri Hospital in Damascus, around 1160, the year which remained active for nearly 3 centuries. The Mansouri Hospital in Cairo, in the year 1270 and forward. And at one time we are told that Baghdad had about 60 hospitals, while Cordova in Spain had more than 50 hospitals. The larger hospitals, they had libraries, they had outpatient clinics, they had medical schools. The hospitals were operated with separating patients with different diseases, particularly when contagious diseases were at stake. Medical education was carried on in these hospitals. Students taught theoretical, practical training, and renowned physicians and surgeons, they were selected to serve in these hospitals. These days we talk about how certain physicians have granted privileges in hospitals. All of that was thought of way ahead of time, centuries ago. The Mansouri Hospital was the first hospital which put together science, teaching, treatment, and social service. Imagine that. Wards dedicated to specific diseases, wards for women, wards for children, outpatient clinics, a library for pursuit of medical knowledge. And Muslim physicians then codified medical education. that the Apostle Khalid al-Muqtadi designated one eminent physician to examine all physicians around and to license those who are qualified to practice medicine, testing, certification, licensing of physicians, all of that part of the Islamic legacy. The advances that Muslim scientists made in pharmacology, new drugs and chemicals, new chemical processes, even anesthetics, including inhalation anesthesia, codified prescription of drugs and doses, all of those are part of the Islamic legacy. And I must, in ending, of course, refer to the Tibb Nabawi, the Prophet's understanding based on divine revelation and his experiences about medicine for cures to physical and spiritual diseases. Perhaps best recorded and interpreted by Imam Ibn Qayyim al-Jawziyah, his epical treatise, Zahab al-Maz, the provisions of the hereafter as guided by the best of God's creation, that's the title. And it deals with both the physical, the spiritual aspect of health and the human body. So my dear brothers and sisters, there's much to talk about, but I wanted to at least pull that scenario together for us. That in Islam, Allah subhanahu wa ta'ala has given incredible importance to our body, the wellness, the sahat, the health, the afiyah, the well-being of the human body, and including the physical and the spiritual and the mental aspect. And there is high push for us to take advantage of the treatments around and to respect and recognize the medical professionals, all that Allah subhanahu wa ta'ala has blessed through his list of providing afiyah and salah to us. May Allah subhanahu wa ta'ala help us truly appreciate the blessings of health and well-being that he grants to us. May Allah subhanahu wa ta'ala, those amongst us who are involved in the medical professions, may be cleansed our intention so that we become focused on serving Allah in all aspects of their profession and career. And may Allah subhanahu wa ta'ala help us support and recognize the medical professionals, and particularly those institutions which are involved in taking care of the needy and serving their health care and body care and mental care needs. Amin ya rabbal alamin. Wa akhiru da'wana alhamdulillah. Alhamdulillah rabbil alamin. Amma ba'd, ya ma'ashara al-muslimin, qala Allah subhanahu wa ta'ala, inna Allaha wa malaikatahu yusalluna 'alan nabi. Ya ayyuhalladhina amanu sallu 'alayhi wa sallimu taslima. Allahumma salli 'ala sayyidina wa mawlana Muhammadin bi'adadi mufaddalah al-fa'al. Allahumma salli 'ala sayyidina wa mawlana Muhammadin bi'adadi mufaddalah al-fa'al. Allahumma salli 'ala jami'il anbiya'i wal mursalin wa 'ala sa'iri sahabati wa tabi'in wa khulafa'ihim wa ibadillah as-salihin. اللهم اعز الاسلام والمسلمين. اللهم قوي ايمان اخواننا واخواتنا في كل مكان، خصوصا في فلسطين وافغانستان وسوريا واليمن وكل الجزائر وكل يوروب وكل افريقيا وكل امريكا وايران والعراق وهند وباكستان وبنغلاديش وكشمير وميانمار والصين وتركيا وفي كل مكان. اللهم قوي ايمانهم وثبت اقدامهم وانصرهم على عدوهم. اللهم ألف بين قلوبنا وأصلح ذات بيننا واجعلنا إخوة في التوحيد. اللهم اشف مرضانا ومرضى المسلمين وارحم موتانا وموتى المسلمين. اللهم ارحم والدينا ووالد والدينا. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما. اللهم فرج كروب المسلمين وعامل روعات المسلمين واستر عورات المسلمين. اللهم إنا أعوذ بك من كل سيء الأفعال. اللهم إنا أسألك العافية. اللهم إنا أسألك الصحة والعافية. اللهم إنا أسألك العافية. آمين يا رب العالمين. عباد الله رحمكم الله، إن الله يأمر بالعدل والإحسان وإيتاء ذي القربى وينهى عن